And we have more plan options now for everyone, especially for the Miami, Orlando employees. They now, I think, have 5 options. So do the partners. The in Virginia and Key West and Georgia, they, I believe, I think they have 3 plans to choose from.
Yes.
Yeah. So, and we've also added Mutual of Omaha instead of Lincoln. So that's changed as well. So we've made quite a few changes, though. We've added more benefits, though.
Good. And one of the things I noticed, Maribel, was before last year with the Basic Life and AD&D, that was only for the salaried employees, and at that time the partners fell into that job class.
Correct.
But this year you guys are also doing a $10,000 flat rate, correct, for all
Yes.
employees, the hourly?
For all employees, yes.
Great.
Which is good, which is a good benefit that I think all the employees are going to enjoy, and be surprised that we're actually giving that to them. It's a nice incentive to also attract employees and retain them.
It really is. I'm going to take a minute and just, send a quick email over to Lauren to see.
I'm actually on the call. I just didn't want to interrupt.
Oh.
Hi, guys.
Hi, Lauren.
Hi.
I'm glad you're here. So, Lauren, just because you were, pretty vital in helping to get these new benefits in place, Alina has the information to basically pull up the guides and things like that. But a couple of the enrollers are familiar with the process from last year, and they understood, the benefits as they stood last year. And they, most of these enrollers on the call are pretty familiar with the BenCell system, the Solarix platform. So you're in good hands there. But could you just take some time to kind of go over the new benefits outside of, I'm sure you heard me say that the life this year is now for hourly as well, a flat rate. But if you want to take some moments here and just kind of recap everything.
Yeah, so like Maribel mentioned, some of the key changes that are going to be happening is in Miami and Orlando, the hourly and the salary and the partners will be offered 5 plans. And then in Virginia, Key West, and Atlanta, Georgia, they'll be offered salary and hourly, the POS plans only. Now, the POS plans, they are available to them. The key thing to kind of remember on this one is if you go over to the benefit guide, and I'm going to walk you through the benefits. One of the main things that sticks out is the hospital plan. There's 2, how do I explain it? There's 2 co-pays listed on there. The second copay that follows, it's going to have it's separated by a slash. The second one is what goes for the people in Virginia. Because it's just a standard benefit that's listed on there. So just keep in mind that for the hospital benefit, that is the copay on it, not the first one. Some other things that are being offered, again, is the 10K Life. The system is created right now to just automatically enroll them. Same thing for the salary and the partners. They automatically get that one-time salary, short-term disability, long-term disability, and it automatically enrolls you in the system as well. Beneficiaries are key to collect just so that HR can have already collected everyone's information on there. So please push for them to pick a beneficiary when they are doing that so she can have current files on that. Dependent socials are a key also when collecting the information for the dental, the vision, and for the medical. I tried to see if maybe we can get around not collecting that, but they do want it for the dental and the vision because they're with Florida Combined Life under Florida Blue, so they require it because it's separate. I think it goes through a separate platform.
No.
For the
I'm sorry, Lauren, if I can add, is everyone going to need a hire date when they complete the application,
It's automatically loaded on there from the census
even
that
for
you
like new
provided.
people? Okay, gotcha. Okay.
Yeah.
Because
So
I could
once,
have provided them with a list just in case, because, what we experienced last year is that we didn't have, a lot of employees didn't know their hire dates, and we had to end
right.
up providing you the hire date, taking that extra step,
Do you have
and
more
extra time.
employees? Do you have more employees that are being enrolled now?
No, I mean, as we hire them, we're entering them. So everybody, if we hired anybody yesterday, they've been updated. So we've been entering them as we go.
Okay, that's great. Now, Christina, if she's hiring them and entering them as of now, are they are they being offered to do anything else? Because I know that when I was going on, it was prompting me for 2019, 2020. Is she having the same on her end or not yet?
So what I did was earlier to make sure anybody who was eligible for this month, excuse me, in the 2018 to 2019 plan year, I pushed out the date for the 2019 plan year to start for open enrollment so you could enroll them first into the 2018-2019 plan year, and then they would be ready for open enrollment. I believe outside of those few people that their benefits were never entered into the system via the census that you're working on, Lauren, anybody who's a new hire, say if they were hired yesterday, they're really bound to those eligibility rules and the waiting period, so they would be enrolling during this event anyways.
Right. Okay.
Lauren, can you just touch base really quickly on which of the plans are offered in Orlando? I see Oscar asked that question.
In Orlando, it's the Blue Care 45, Blue Care 67, Blue Options 03766, Blue Options 03768, and Blue Options 03748. All of the plans that are listed as Blue Options are the POS options with the in and out of network benefits. The Blue Care 45 and Blue Care 67 are their HMOs.
Okay. And Oscar, they're in all of the different, you'll see there's quite a few guides that were added. So they do give you the access of which ones they're all eligible for in the employee guides. Now, Lauren, one of the questions I have really quickly for you as I was doing some testing was for employees who enrolled the medical, dental, and vision, it looked like they might be bundled. Are they supposed to be bundled? Because we did see separate pricing in the workbook, so I just wanted to make sure since I have you on the call.
It's a bundled package with the carrier, but they're separate rates.
Okay, so if they enroll in medical, they have to get dental and vision?
No.
Okay, good. I just wanted to make sure. So basically, they do have the separate rates, but they can enroll in any of the three benefits or all three benefits. None of them are dependent on the other. Perfect.
No.
Thank you.
No problem. Another thing here that I wanted to mention was on the dental HMO plan, they are required to list the dental provider on there. Same for the Blue Care 45 and the Blue Care 67. And I did see that there was a link on there that prompted for them to pick the provider, and it's supposed to take you directly to the Florida Blue link. I know you were working on fixing it so that it can go and say HMO and POS when they're doing the provider search. Were you able to fix that?
We're working on that, just so you know, those last few changes that you had sent over yesterday.
Okay, so in there, it's pretty hands-on. You can go ahead and click the link and it'll take you to the provider search. Just please make sure that you're entering that information. Try not skipping it by all means possible so that when they get sent over to the carrier, they don't have any issues when they're getting their ID cards, that they have the wrong provider, that they have no provider. For the Blue Option plans, I included the link in there, and it requests you to pick a PCP, but you don't need to have one. But I put it on there just in case the employee has questions whether or not they're covered or not. So that is going to be on there as well. Same thing for the dental PPO, but they don't need to list it. For the vision, they don't need to pick a provider, and that's pretty much it on those key points on that. I can go over the benefit guide if you like. Hello?
Do any Oscar and the rest of the crew, do you need her to go through each of these, or do you feel pretty confident like you can run through these guides?
I can go. This is Jose. I know I can go through.
Okay, great. And then for all of you on the phone, as you know, you can shoot, for some of the questions as you're going through them too. And Lauren, I definitely want you to touch on the key points on each of them for sure, because they are each a little bit different. But as you're going through in-depthly reading, tonight, tomorrow, if you have questions, don't hesitate to send them over to myself and Cece and Scott and or Alina, because we'll get answers to you as quickly as possible.
Yeah, the plans are pretty much based off of a copay anyway. Very little of the benefits are by coinsurance. Mostly all of them have a copay for all the benefits that are listed on the guide anyway. Again, the main thing to focus on is on those blue option plans. When you're in Miami and Orlando's guidebook, it's the first copay, and then when you're in the Virginia, Atlanta, and Key West guidebook, it's the second part for the hospital copay. Please do not try to remember that. It's a very key factor when you're explaining benefits. I don't want the employee to think that they have a $200 copay when they go to the hospital and then they have to go and it's something else. It's the higher copay on their plan due to the network.
Alina, are there a couple other things here? I know Scott normally kind of runs this side of it, but are there a couple other things you'd like Lauren to touch on?
Well, I just, I thought that this was displaying correctly. I don't know if you can see my screen, but for some reason I'm getting dental and vision cover kind of overimposed in the guides.
Yeah.
Is it
Yeah,
just is it just my screen, or is it? I don't think it's there. That's really strange. I'm sorry. But
no, it's the document, because I opened my document straight from the email myself just now, just to verify the same thing you were looking at, and my original email that I got is the same way.
This was the same way. Okay.
It's overlapped.
Yeah, it's really strange. And I thought I looked at it yesterday and it wasn't there. So we'll make sure we'll look at it and see if we can get a clean copy of this. But it's kind of hard to read right now. But yeah, if you can just, because we do have 2 enrollers that are kind of new to this. So again, just to recap, the medical plans are new, right? You went from United Healthcare to Florida Blue.
Yes.
Correct.
So everybody has to go through this process and make their elections.
Yes.
Correct. Awesome. And then we have the grouping is kind of different, but the system, you guys, when you're at your locations in Orlando, Miami, the system is going to display the correct medical options. So don't worry about it. It's a little bit confusing right now because there's a lot of benefits guides, but basically we have Atlanta, Key West, and Virginia is grouped in one. And then you have Miami. Yeah, and Miami and Orlando are the other version of the.
When I did the testing, everything seemed good. Like it only planned out whatever was available to that
Fantastic, area. Fantastic, very good. And then for those, again, the agents that are new, so each of these have 3 categories. You're going to see hourly employee, you're going to see salaried person, and then you might come across partners. So again, the system is going to know which benefits are paid for, what they're offered, so don't worry about it. But basically, the salaried employees get the disabilities, right? Short-term and long-term disability. And
life, short-term,
life,
and long-term.
Gotcha. And then partners, they just have more employer contributions towards their benefits, right? And again, the system will tell you what those prices are and what's
Right, and
offered.
they also get the 1 times the salary life, the long term and the short term.
Perfect. Paid for, right, by employer?
Right.
Gotcha. Excellent. Very good, very good. And then dental and vision are the same for everybody, for all locations, right? Is that correct?
The plans itself, well, no, they're the same for Miami and Orlando. And then for Virginia, Atlanta, and Key West, they only have the dental PPO option.
Ah, gotcha. One dental plan. And again, the benefits guides, we'll get them corrected, how they're displaying, but that will show you guys. So it is important, just go over things that are pertinent to your location. So don't worry about Virginia if you're going to the Orlando airport, okay? So you don't get confused. All right, I think it's all I saw. It's pretty much self-explanatory, the rest of it.
I wanted to just touch base with Maribel real quick with you guys about the actual locations. I'm not sure if she was already able to go over that before I jumped on the call.
No, and I was going to go over the schedule with everyone. If our agents are good, do you guys have any questions about medical, dental, vision?
Hey, Olina.
I'm good.
Thank you, Jose. Oscar, yes?
So on the email that I received from you guys, I got a bunch of PDF files with about, I don't know how many
Yes.
different plans in there. So all that we need to focus here for Orlando and Miami is the
Exactly.
UHMOs and the 3 PPOs that she mentioned before.
That's right. And you're going to see for Orlando, you're going to see salaried and hourly. So that's the two distinction. And you know, when you're getting into the system on that first screen, you're going to see whether a person is hourly or salaried. We can show you that when we get into the system. But yeah, that's all you have to worry about. So even though there's a bunch of PDFs, just look at the ones that you need for your location.
That will pay for our location. Okay.
Yeah.
Now, I know that.
Would it help any of you if I sent you the complete summary of benefits as well, like a copy aside from having it on the Forms library?
Sure.
That will be fine. Yes.
All right. So that's good. If you guys don't have questions, and again, if you look at it tonight and tomorrow, just let us know if anything pops up that you have question about. But if I may, I would like to go ahead and look at the schedule to make sure we're all on the same page. So we have Miami, Orlando, and Virginia location. We're going on site, and then Key West and Atlanta is a call center. So for Miami, we have Jose and Daryl. The hours are from 9 a.m. to 4 p.m. And Jose, you have a little bit adjusted hours there to the right. You see 9:30 to 12:30 and then 1:45 to 4. Orlando, we have Oscar and Lady from 9 to 6. And the days are Tuesday, Wednesday for Miami, Tuesday, Wednesday, Thursday for Orlando. And then we have Tim in Virginia for Tuesday, Wednesday, Thursday, and we go from 9 to 6. All right. So please make sure that you kind of communicate with your contacts. Remember the second page on the Excel, the schedule, the second tab gives you addresses of where you're going and your contact name and their phone number. It is very important, especially if you go to the airport, that you allow enough time to get there, park, go through security. So you'll basically have to contact your person. And Jose, you've been through it, but my Orlando people, it's going to be Jeff. And you just give him a call on Monday and tell him, hey, we're going to be coming in. We would like to come in at least half an hour before you get started. And then he'll meet you at the, I guess at the security where you actually need to have a ticket to get through. So you're actually going into the airport terminal, and it's a very, high security place. So you have to be escorted, even if you go to the restrooms. if you want to go out for lunch, you have to be escorted out through the security. So just please allow enough time for that. We would like you to be at the location ready to go about half an hour before to make sure everything is good. In Orlando, it's the Southwest Airlines terminal. Not sure what it is in Miami, but if you guys just contact your person, you'll be fine. And Jose has been there before last year from Miami.
Yes.
Olena,
Uh-huh.
as far as the parking, I know we might gonna have to park on the regular parking at the terminal.
Mhm.
Are they gonna do the validation for the parking, or we have to pay for the parking?
You will be reimbursed for it. We'll just have to get the details for you because, yeah, we'll let you know outside of training, Oscar. But we'll get you reimbursement. There's no problem.
And you said that's gonna be on the Southwest terminal?
Yep. Hmm.
Southwest.
In Orlando.
In Orlando. And what is in Miami?
Concourse F is in Frank.
F as in Frank.
F as a Frank terminal. Perfect. Hmm. And then Tim, you were at your location before, so you should be good there. Awesome.
Yeah.
Fantastic.
Yeah, I think so.
In Virginia, there's more than 30 employees. Just a heads up.
Oh, okay. The more
There's a lot more.
the more the merrier.
Almost double.
Oh, really?
Yeah, almost double. And in Atlanta, probably is a little bit more because we just opened up the Sbarros like last year, and we have also acquired a couple more, but it's only like another 5 more employees. So Atlanta and Virginia are
A little bit.
low in employees, but it's going to be more. In Virginia, there's at least 60
Gotcha.
or more.
Hmm. And are they all
We
going
have
to
2
be
locations.
2 locations?
Yeah, in Virginia we have 2 locations that, like 2 concourses, and that the manager or can go ahead and escort him over there
Hmm.
and have him sit in Pizza Hut. Yeah, like where it says ALM Services, they're going to be contacting Mike. ALM Services is when we're going to mail something. That's just a company that's across the street from the airport that delivers supplies and things to the airport. But yeah, he'll be contacting Mike for, meeting him outside to go through security.
More specific, yeah, instructions. I think we got it because Tim did that last year, so he should be good. All right, very good. So that's the schedule. And then I was just going to kind of briefly go over the voluntary benefits. They are all already in place. So you're going to see a lot of employees that already have it, so you can just kind of review with them what they have, if they have any questions. One thing that I want to mention is in the training invite, there was an Excel list of people in the Excel format that had previously signed up for group term policies, but these were not actually issued, or it wasn't implemented. So these are the people that we want to make sure we offer universal life. Just kind of keep that in mind, and that's why we send that list.
And Olena, actually, I'm going to update this list for you, just so you know, because I'm adding everybody's current benefits, uploading it into the system. So I've been going to my list that I have to upload today. And there's a few people that did make the change as well to the Universal Life
Already?
just recently, but it wasn't updated from this report that we had pulled last time. So I'm going to take off all the people who did make their change for you. So you'll get an updated list later this afternoon.
Yes, and on the system, agents, you guys know this, but just to review, when you click on the coverage tab, it's going to show you what they currently have. So if they have UL, you're going to see it in there. But these voluntary benefits are offered by Allstate. So first one, we have Universal Life. So it is a permanent policy. It does have the accelerated death benefit rider. We have a long-term care rider inside of it, and then the terminal illness rider. The guaranteed issue amounts are no longer in place because it's not. It's a re-enrollment. This is not a new enrollment. So guaranteed issue would be only for people if you have anybody who's been very recently hired, which sounds like they have been done perpetually. So that should not be a case. So they can still get the universal life. They'll just have to answer a few questions to qualify. Okay.
Now, Alina, what about those? They did list that requirement for those who are currently on the group term life. Now, those folks, like, are they going to have a way of not having that option, or are we going to have to manually pull the EOI?
Say that one more time. I'm so sorry, Lauren.
So whoever's on the group term life now, that's no longer going to be continuing the coverage because it's not going to be offered. They have the option to go onto the universal life product without needing an EOI. So going forward for the enrollment, how are they going to be? I know that they have the list, but how are they going to avoid the EOI requirement? It's not going to prompt it.
So what I'm going to do is I'm going to work, as soon as I have the list updated today, I'm going to work with my IT team to figure out how to load them in a way that will make it so it won't trigger for that. If there isn't a way to work around it, obviously you'll have to go through the EOI and just let them know that I can unpend that after they go through the enrollment itself.
Yeah.
Because they'll have been pushed through, and I can send that over to Allstate, a specific list with those specific employees.
Mm-hmm. And this would only happen if they answer yes to one of the questions. So, kind of keep an eye out for that. If you guys are enrollers, if you do see that somebody was on that group term life list and they are moving over to universal, just kind of keep an eye on it. If they say yes to the question, it would be very helpful if you alert me, Scott, or Christina, and just we'll follow up on that as well. So these are the rate sheets. We don't need that. Towards the end of this document, you have the different riders explained. So again, the long-term care, you guys are familiar with it. You can use the amount of your death benefit dollars. You can use it towards a long-term care facility charges. You can do 4% monthly, so it comes up to 20. I think it's 2 years, right? I'm sorry, my math is really bad at the moment, but that's the long-term care benefit. And then terminal illness, they can cash out 75% of the death benefit while they're still alive if they are diagnosed with terminal illness. All right, so that's Universal Life with Allstate. And then we have, let's see, the proposal for Allstate products. The rest of them are Florida group products for accident. It's a 24/7 coverage, so on the job, off the job. We have the hospital confinement benefit, the initial, so once a year they'll get $2,000 if they're hospitalized after accident, then $400 a day for as long as they're there. It goes up to 365 days. Intensive care unit, it's going to be additional $400 a day in a hospital. It goes up to 180 days per accident. Dislocation and fracture benefit, it goes up to $6,000 depending on what it is, what kind of fracture. Ambulance benefit, $300. Physician treatment after accident, $150. X-ray, urgent care, accidental death amounts, $60,000 for employee. Emergency room, $300. This is kind of a bonus benefit. Remember, outpatient physician treatment for accident, $50 is something that you would receive even if they submit like a dental cleaning visit or having their eyes checked. So this is really nice to kind of make sure people know about that. Two times for employee, and then for family coverage, they can do it 4 times each year. All right, and then the benefits continue. Second page, there's a lot of things here. I'm not going to go over everything, but all kinds of injuries, surgeries, follow-up treatment, physical therapy, transportation, and then in the system, the rates are going to be bi-weekly. So don't worry about these numbers here. The system will calculate it for you, but I understand everybody is on a bi-weekly pay deduction schedule, right?
Yes.
Fantastic. Yeah. Awesome. Very good.
It should be.
And then accident plan here, all of the benefits are explained here. So this is very nice if you don't know about specific one like transportation or, what does it exactly cover. If you have that question, you can look at the details here. We are very familiar with these plans, so our team here is veterans and they know the structure. So I'm moving on to the critical illness. It's a group voluntary critical illness coverage. We have $10,000 or $20,000 options. You have the initial critical illnesses, the standard heart attack, stroke, organ transplant, kidney failure, and then we have partial benefit for bypass surgery, cancer critical illness benefit is included, so additional illness of cancer, and then you have in situ, so localized organ cancer is a partial benefit. There is a second event initial critical illness benefit and a second event cancer benefit. Just know that on these, the separate illnesses have to be separated by 12 months. And then as far as paying within this first category, let's say somebody has a heart attack and then they have a stroke, there has to be at least 90 days between these two in order to pay out again. All right, but the plan is going to pay out each illness at least once. And then if they get it again, then you have the second benefit. So it's actually twice, but make a note of that. And then wellness benefit of $75 per year per person. So this is very specific preventive cancer testing that's listed a little bit below here. Before I move away from the screen, there is going to be a pre-X limitation. That's 12 months. 12 months before effective date, which is April 1st, and 12 months after the effective date. Dependents receive 50% of the employee's benefit. Please remember that children and employees have the same price, so there's no reason why they shouldn't have kids on their policies. And again, there's going to be qualifying questions for if they sign up now because they're late entrants, so you will see medical questions. The rates are based on tobacco use. Again, it's bi-weekly rather than weekly in the system. A little more details, benefit descriptions. If somebody says, what does it mean a stroke? Because there's different specifications. So just know that you have that information in there if needed. Carcinoma in situ, invasive cancer, diagnosis requirements, description of second event, benefit, and then wellness benefit. Here are the different tests that would qualify for that wellness benefit of $75. So just make sure you're familiar with that. It's not just the physical visit. It's not just, physical exam. It has to be one of these specific tests. All right, an explanation of pre-existing condition comes in handy. Exclusions, cool. And then we're looking at hospital benefit. So I've noticed there are, again, two different ones. There's one for Florida coverage, and there's actually, yeah, Florida and Virginia and Georgia have a separate benefit. So again, you guys, based on where you are, make sure you're looking at the right benefit description. All right, but for Florida, we're looking at three options. You have a daily hospitalization benefit. You have intensive care unit, which is it's adding to your daily hospital. So it's 90 plus 90. So it's really 180 if they're in the ICU, depending on what option they have. There's a surgery benefit, waiver of premium if they are disabled after hospitalization. Additional rider, and they're getting additional initial hospitalization rider of $900. So that's once a year. Okay, so if they're hospitalized twice, they're not going to get this $900 second time, but they'll always get the daily benefit. Doesn't matter how many times they're hospitalized a year. You have another surgery and anesthesia rider benefit, so additional money is coming to them. And then also outpatient physician rider benefit, any doctor visit, so that means dental visit, vision, or earache, it has nothing to do with hospitalization. And they can get $45 on this option and $90 on the other two. All right, your premiums are going to be displaying in a system correctly for the biweekly frequency. And then here's the second version of hospital indemnity shop plan for Georgia and Virginia. So numbers are different. Just make sure you're looking at the right thing. You're explaining the benefits. And again, further description of what each benefit means. I'm not going to go over everything, but we have a lot of information here. Yes, pre-existing condition applies 12 months before effective, 12 months after. And there's a description of it. And that's that on a hospital. And then this is the term life that's no longer available. I think that's it. Right? We have hospital, accident, critical illness, and that's it for voluntary plans.
I just wanted to add one more thing on there, not in regards to the voluntary plans, but the actual system when you're electing the employee to start the enrollment. One of the key things that they're also asking for Mutual of Omaha is the occupational title. So that part is going to prompt you to, enter it. Just please make sure that they do give you the correct occupation title that they are. Many of them work in restaurants. Very few of them work in retail. So, bartender, server, anything like that. If they're a manager, you'll notice that the department already lists that they're a manager. Just put that they're a manager again for that location.
Perfect. That's a good point. Very good. And everybody's eligible if they're working 30 hours. So just know that you have to make sure that their hours are in that first screen. Christina, do you want me to go? Are we ready to go into the system?
Yes, give me one moment here. I'm getting my screen ready to show. The link that
you provided me, is anybody else having trouble going on that link or no?
I haven't. I've used my own link. Let me see.
I tried yesterday and it worked pretty good.
Yeah, I just got in, so it looks good.
Are you able to log in?
Yeah.
Or Lauren, are you talking about the link to see Alina's screen?
Which one are you going to be working on right now?
I'm going to go, she's going to pass to, and I'm going to, okay, so the go-to meeting, you can't see it when you click on the go. Okay.
Oh, make sure you're I think that it's browser sensitive, so it has to be either Chrome or Internet Explorer.
I'll try Internet Explorer now.
Yeah, it won't let me open in different browsers. So Christina, do you want me to, if you see my screen, I can just run through this? Or?
Yeah, it's up to you. I can run through it or you can run through it. I'm happy either way.
Okay. So I'm going to employees. Go ahead.
Oh, I was going to say when you click on an employee's name, I was just going to suggest that we show them their departments are already there, their, whether they're hourly, salary, or a partner, and the title is where we want them to put.
Yes, I've already went into this person and I played around, so I put Mr. But this is where you would put their title. So you need to ask for it. So it's that first screen when you click on the person's name, and you have your hire date, you have job class. So this is where you would see it's salaried or partner. And then you do need to put in title. It won't let you go to the next screen. We don't need salaries at this point, so I think that $1 is fine. But you do have...
Actually, we do need salary. Just so you guys know, we do need salary because that's going to be for that short-term disability, the long-term, and the basic life. So please, please, please check everybody's salary and make sure it shows more than $1. I know Lauren's been helping us with getting some people who we didn't have it previously for, but just in case, that's a hot button item for you to check.
Okay.
And the main employees that are going to be offered the salary and the partners. So there's not too many on there anyway.
Right.
And for the most part, those employees in particular, their salaries are already
loaded. Perfect. So yeah, for the hourly, they don't have disabilities, so it's not as big of a deal. So, but they're definitely hours because they won't be eligible. So put in at least 30 hours a week. Title. See, so it doesn't let me go past. Doesn't let me leave the title empty. So I'm just gonna say waiter.
I think he's a manager. I think he's salary and a manager.
Oh, really?
Yeah.
Paul Acosta.
Did that change?
Yeah, because he's hourly.
Lauren, and we need to update him in the system?
I'll tell you right now.
I'm sorry, I missed what was said.
She put him in as a waiter, and Maribel said she thinks he's a manager, and it would change his offering.
But he's coming up as hourly.
Yes.
He's been a manager since, I'll tell you now.
Just a test, though, right?
Olina?
Yeah, we're just testing.
Just to be clear, so we're going to be updating information on the employees site, right?
Yes, for hours, you need to put hours in there, how many hours a week they're working, and then if their title, what their job is, their job title, and then you have to notice if the person is coming up as hourly or salaried. If it's a salaried person, we do need to put their salary in there because they have disabilities, and those are calculated based on their income. So if an hourly person has their salary, just put it in there. It's not a big deal. But for the salaried person as a job class, you will need to ask how much how much they make a year.
And partners
do they have
as well.
I'm sorry. Do they have that information? Because usually employees, they say like, well, I don't know how much I make a year or something like that, or they don't want to give that information. Is that something common for them?
For the most part, the salaries, there's the salary and partners that require the information. Their information is already going to be loaded in there.
Yeah. So the hourly,
they won't come across too many of those.
Yeah.
The hourly employees will tell you I make, $15 an hour. And, if you do a quick math, you just do it, 15 times 40 times 52, and that's their annual salary. Basically.
Right. Exactly. Yeah. But we are not able to, lady, you will not be changing their job class. We're not able to do that. So that's already going to be loaded in the system.
And Maribel, did you and Lauren, did you say Paul actually should be a salaried employee
Yes, ma'am.
and a manager?
He was a salary. Yeah, he became a manager in August 2018.
See, I have an option to change it because I have like manager access. So, do you want me to do it now, or do you guys want to do it on your end? Is that okay, Christina?
Yeah, that's not a problem at all. If you want to go ahead and run through that, just so it updates and we know he's ready for open enrollment. Can you change the date of change to, you said it was what, 8?
August 2018.
Ooh.
Thank you.
Now, if we run into issues like this, which hopefully we don't, because after the system is ready, we have to do a census check anyway. If there are any changes that are not processed by then, the enroller is not able to change the job class.
You have to change his title.
Did I change his title?
Sorry. You left him as waiter.
Oh, I'm sorry. I'm gonna reset him anyways. But what is his title? Manager? Just manager?
He's a manager. Yes, ma'am.
Okay. No problem.
And now
He makes
Salary, yeah. We now need a salary.
41,600. 41,600.
600. Okay.
Perfect.
All right.
And what I'm going to do is, Lauren, as soon as I finish loading all of that Allstate existing, I'm going to send you a census anyways to just kind of review everybody.
Okay.
But, it's probably a good practice if our enrollers are sitting with someone, it doesn't hurt to confirm. You are an hourly employee, right? And just that way we kind of catch it.
Olena,
Yes.
that PIN number that I saw on the screen, is that for you only, or that's going to be for us to have a PIN number in there?
You won't have to do that. Like you will not be changing people's job classes. Like you're not even able to do that.
That's only for you.
Yeah. You're just gonna be putting PIN number at the end of the enrollment like we normally do. You can use the employee's last 4 of social and then their birth, 2 digits of their birth year.
So last 4 of the social and last 2 of the year?
Yep. And you can also use yours. If it doesn't work, if you get error message, you can use your login password. You're signing.
Okay.
Yeah. Or your password that you have for the system.
Okay.
Cool.
I have a quick question. So I know you're going to send me back the census. We're going to review it one more time. But if something is missed where it's not loaded correctly and the enroller cannot make the change, who do they contact at that time so that they can continue enrolling the employee?
They're going to shoot me a quick email and I'll be able to reset that person.
Or Scott or me, Olena,
Or Scott, yeah.
Yeah. We all jump on it at the same time. So I think I have to log out. Christina, do you see the screen? I think I have to log out now. It's not reading that it's open for open.
Again, I'm going. Oh, it did change it for you. Good.
Yeah, let me see if I can. Because
There it goes. It's just going slow.
Hire, eligible, active, enroll.
Olena, just so you know, I'm using Safari and it's working on Safari as well.
Safari?
Yeah.
Awesome. I know that Opera doesn't work. When I try to do it in Opera, it's not liking it.
I just log in and everything looks fine here on my end.
Fantastic. All right, let's see if the phone numbers are required. Yes. Phone number and emails are required. I'm going to reset this person, so.
And again, they'll get the email confirmation with their plan, right?
Yes, that's one of the reasons why we love to have that email from them. Now, Maribel, there's always the few employees nowadays who don't have email. Would you like the enrollers to put in your email so you get a copy and you can have somebody print and give to them? How do you want that handled?
You're going to run into that in Virginia. If they really, really like don't have an email, then you can go ahead and put mine in there.
Okay.
Yeah.
Do we have that information?
I was going to say I'll send that over to everybody.
Okay.
Great. So this person, because we changed his job class, now you see that his medical options are, the plans are covered by the employer. So it will automatically change for you whatever the benefits are based on the class. Okay. So then you would have to go and look at the correct benefits guide that you're using for salaried person. Okay. And you'll see the details of the medical options. But let's just say this person wants the best plan there is. Well, maybe not. Let's do this one. $76, the most expensive one. And then it jumps over to critical illness. So, have you used tobacco in the last 12 months? No. The rates and options will come up, so either 10 or 20,000. I'm going to take the 10. Remember, if there are children, we all know how to add the dependents, right? So if the person has 3 kids, let's say, hey, for the same price, you can add children on there. And you could just go even back from the screen and add them in there. We know how to do that. If they have socials, great. If not, try to have them get it to you. You know, you're going to be there all day, so just ask them if they can to get them to you. That's really good.
But it's not going to be required the Social Security in order for us to come to speed up the process.
Well, you do need it for the other coverages, so.
Yes.
I was going to say, I believe we have it set to require that. So what I would do is if the person has to step away, we tend to use a number that starts with 888. So if you have to put in a dummy one, if you're willing to at least try and keep track for us. Otherwise, when I pull a report, if I see 888 show up, I know that's basically our test numbers that we tend to use. So that would be helpful. At least we could identify them and help Maribel to get us the true Social Security numbers for the family members.
Mm-hmm. Yeah, but try to get it while you're there if you can, you know. So I'm not going to do it just to not mess up this person's profile, but so I'm bouncing back to critical illness. I'm choosing my coverage level. Next screen is your beneficiaries. Of course, you can, with the plus sign, add anybody else. They can have as many people as they want to, primary or contingent. And here are the few questions. So do you currently have critical illness policy with Allstate? No. Electronic acceptance. Do I want to receive all the communication of my certificate via email or mail? So if they're okay with email, say yes. Make sure you collect that email. And also all the other correspondence, the email. Representation, understanding on authorizations. I have read and I had read to me completed application. I understand. Yes.
Do we need to say that verbatim? All that?
We normally don't. I mean, they're looking. Make sure they're seeing your screen and everything you're going through. That the employee sees all the numbers, everything they're getting. Okay, that's just a common practice. Yeah. So this is. Why am I back here? Did I hit cancel?
You did. You were going to add a dependent, and then you didn't, so you went back there to it.
Gotcha.
And if I just might add, with anybody who has a current benefit, if they're keeping that benefit and you're just reviewing that page, all you have to do is click next. You don't have to re-enroll in it. It'll say no changes, and you can just click no changes or next. If you need to make a change, it will allow you to open it up at the bottom and make the change. Say if they're going from 10,000 to 20,000 for critical illness. Otherwise, it's just no change and keep going past the screen.
Got it. Good point. So accident plan. There's only one option. If I had dependents added on, then we would have the other tiers, employee and spouse, employee and children. But on this one, there's just one option. We're going to say, yes, I want it. Adding beneficiary to the accident plan. You can add new people or elect the ones that are already previously were assigned to critical illness. Do you currently have an accident plan with Allstate? No. Representation, yes. And scroll down. Next. Agent statement. I certify to the best of my knowledge that all the information on this form is complete, accurate, and correctly recorded. Are you changing existing accident coverage? No. And here's the hospital indemnity plan. So again, wherever this person is located, you're going to see the appropriate version of that plan. And the prices, and we have two options. Okay, so let's say we want that. Employee only.
I have a question. Why is there two options?
We had, let's see. There are two versions, two levels of the plan. You know, one pays more. So this person was Florida. Let's see. So this was on the proposal. So
It's technically, it's not like a whole set. It's like a different level.
yeah,
one
it's
policy.
yeah, it pays different amounts. So let's see.
That's okay. I understood it differently.
Yeah, option 2. So 1 and 2. I believe option 3 was not used.
No, it's only the option 1 and option 2.
Yes. So 1 is $90 a day in the hospital, and 1 is $360. So big difference in how much it pays out. Good question. So and hence the cost. You know, it's $9 versus $19. So, and if they currently have it, you're going to see this yellow ribbon that's going to show you they already have it. So they can either keep it or upgrade. If you don't do anything with it, it stays the same.
What about they want to cancel anything that they currently have? Do we cancel that, or they have to call and cancel the coverage?
Christina, do you want to answer?
You'll go ahead and you'll be able to use on the page. It'll say, I wish to cancel or decline this coverage. Click that radio button.
But we also want do we want them to call as well to cancel? Or is it going to be okay just to do it on our end?
It's okay to do it on our end and send over.
Okay, perfect.
Because we do process throughout the year as well for when employees have a life event change and they need to terminate a benefit or if they were terminated. So it does feed over.
Oh, perfect.
Direct to Allstate.
Fantastic. Very good. So is any person to be insured actively at work now, working at least 20 to 30 hours a week, performing all the duties of their job, and it was for the last 6 months. They were not, they didn't miss work for minor illness or injury of 1 week or less, or normal pregnancy. So the answer would be yes. I'm working and I have not been sick. Representation, I have read and understand, yes. Producer statement, yes, all the information that I've collected is correct. And here's our universal life. So we have to say if they are tobacco users or not, and then are they working working actively at least 20 hours a week, and they have not missed work for the last 3 months for more than 1 week or less, except for minor illness or injury. So kind of the same question. So we have to say, yes, I'm working and I have not been sick. And you have sliding bar, where you can choose how much they want. Let's see how much is the max. So this person can get all the way up to 140,000. It's actually a really good price. Wow. Okay. So let's just go kind of easy. 90. Oops.
Alina, you mentioned that we're gonna go only offer the universal life, right? No term life.
That's right. Yep.
So this is the only life insurance they can get access to.
Yep.
Okay.
And you see, it's not there anymore. Like it's not one of them on the menu. So it'll just show you what's available. Again, we choose beneficiaries. You're welcome to add anybody they want to put on there. And here is where you're going to see the questions. So are we replacing? No. Do we have existing coverage? No. Now this question on illustration, the owner certifies that no illustration was provided. So the answer is yes. We did not give illustration. This is agent-producer question, so we're not replacing. There's no existing, and yes, I did not give illustration. Long-term care rider questions. So this is a third-party designation to receive notification of lapse or termination of coverage. So they can assign somebody, or if they just want to keep just themselves on that, that's fine. But if you say yes, it's going to go to the next screen and ask you for that person's information. We're not replacing any other long-term care insurance. There is no existing long-term care insurance. Do you have another terms during the last 12 months? No. Are you on Medicaid? I am going to answer this as not applicable. Christina, the question is, list all health insurance policies which you have...
That's what I was just going to say, is with those, if you do have to answer any of these questions, I tend to, unless they have something they do need to put in there, I do put not applicable. And as you know, you're on the agent side. If you're logging in, say on the employee side, using their information to log in, those questions shouldn't come up.
Gotcha. Like on a self-service portal?
Yes.
Gotcha. All right. So here are the underwriting questions. In the last 10 years, have you tested positive for HIV or AIDS? Okay. In the last 2 years, have you been diagnosed or treated by a licensed healthcare practitioner for any of the following? So this is very important that the person sees all of these conditions, okay? And then hopefully the answer is no. Even if they say yes to one of these questions, that doesn't mean they're automatically going to be declined. It's just going to be reviewed, and then the decision is going to be made later. So just so that you know, it doesn't automatically mean they can't get it. So the blood pressure question, in the last year, have you been diagnosed by a licensed healthcare practitioner with a systolic blood pressure reading higher than 150 more than once, or diastolic blood pressure reading higher than 100 more than once? Okay, make sure you read that full question, because they might have been diagnosed once, not twice. Has any person to be insured in the last 3 years had their driver's license suspended due to drunk driving? In the last 5 years, have there been any surgery? Okay. Again, read the question carefully to them. Hopefully they're in good health. Height and weight. is required. And representation, yes. Produce a statement, yes, all my answers are answered correctly. And then you're done with the voluntary plans. It goes to dental coverage. This particular person does have an option based on their job class. They have an option of HMO or PPO on the dental. Notice it's both of these are covered by the employer because it's a salaried person. So you just make a choice here. They want to add family members to it. This is where we would choose their dentist. So are we saying that these links are not set up yet?
She said she'll have it fixed by tomorrow.
Perfect. And we'll provide to our agents a way to get to the right place. So make sure we have the name of the network and all that good stuff. So for right now, I'm going to just say, I don't know, doctor, dentist. It's pretty bad. You know, let me just not even do that. I'm not going to say dental.
So we need to have the doctor's name and phone numbers for them to...
Yes. Yeah, so there's going to be a link that's going to take you out to that carrier's directory, and they'll have to put in their zip code and choose from the dentist.
Now that's only for those who pick the DHMO, which is only those in Miami and Orlando.
Gotcha. HMO. So let me try to do the other one. We'll see.
It might still be on there, but it's not required, so you can just hit next. Just in case, because I know people sometimes, can you just check if they take my insurance?
Yeah. Oh, no, it's not asking for it. But yeah, we'll send, usually there's like specific steps. You click on this, you click on that, you know, providers network, and choose by their zip code. So vision coverage, there's just one plan, really straightforward. Here's that basic life insurance that's different for salaried people, so they get one time their salary at no cost. And all the hourly people get $10,000. So you see that difference. You have to choose beneficiary for their basic life. And here are the short-term and long-term disabilities that are covered by the employer if you're a salaried employee. So you see zero cost to them. And in their benefits guide, there's explanation of it. You know, elimination period, benefit period, and all that good stuff. 60% of their income is the benefit amount. So I looked at it. It's very straightforward. Nothing crazy. Again, let us know, guys, if you have any questions about it. Long-term disability. So it's giving you on a short-term disability. It's showing you their weekly benefit. If they're disabled, how much they would get. And on the long term, this is a monthly benefit. So this is already showing 60% of their salary a month. And there's no cost to them. Employer is paying for it. And that's it. So we'll come to a sign and submit page. If they want to make a change at this point, you guys can go back and unlock. Please make sure you review every single election with them. Make sure they're looking at the screen and seeing their pre-tax and post-tax deductions. Verify that that's what they want. Then you're moving on to signing all the documents and forms just by clicking through it. And then we're going to sign with our employees' credentials. Like we said, you can do, this is a really nice thing. This is what it's going to be emailed to them if they provided us with an email. And I like this page because it gives you a total deduction. So pre-tax and post-tax, and it adds it up. So again, make sure they know exactly what they're getting and sign the form. So right now I just have my login in there, but this person would be last four of their social and their 2-digit birth year. So if they were born in 1972 and their last four of social are 1, 2, 3, 4, so it's 1, 2, 3, 5472.
That's just if they're doing it through self-service, so correct? Or they have to sign it doing that?
Normally, you can do both. Christina, is this different in this case?
Yeah, sometimes when you're in as the enroller or the HR, you can use the employee's PIN, but there are times it just does not. For whatever reason,
Yeah.
technology is our worst enemy and our best friend at the same time. It won't work. But if you are in via the self-service portal, you're going to use the employee's last four of their social, last two of their birth year.
Mm-hmm. Yeah. Perfect. So that's it. You'll see the screen that says your enrollment is now complete, and you can either come all the way to the bottom and return, or sometimes it asks you to log out and you have to start back in. So that's basically it.
Alina, one question. Are we going to have interviews, or are we going to have schedules, or they can come to us like whenever they want?
Good question.
There is a scheduler built. So I'm trying to capture as many as we can, so you'll have some scheduled appointments. Maribel, are you going to work with your managers at each of the locations and just kind of help maybe push people over when the enrollers don't have somebody sitting down with them?
Yeah, I have an email going out. What I'm trying to do is, send the email out with the flyer and have as many people go through the system, self-enroll as much as possible since we have so many employees. Those that, wish to actually speak with someone, I'm going to let the managers know to either schedule them so that the flow is constant. There will be a time which maybe, depending on the unit, perhaps that we're very, very busy and it's during lunch, which maybe they can take a break and they can go to lunch and then come back. But we're going to try to, send the flyer out first, have them tell all the employees, then, the ones that need to speak to someone, have them, be responsible and be in the restaurant so that they can just go ahead and, either sign up or ask any questions and just move on right along.
Christina, on Monday is your target date for it to be live already, right?
That is what we have, is Monday for it to be live, especially for, as you said, there's those tech-savvy employees who kind of have a good grasp on going through the system, not only on their own, but understand benefits and stuff. We do want to give them that opportunity to get through there. And then the scheduler, for example, if you're having managers schedule the employees, at least they have the opportunity to go to their manager that day and say, hey, I tried this, I need some help still, and they can make an appointment. Otherwise, you'll see if they're making their own appointments, once they try and go through it, they'll be able to go ahead and make an appointment for the rest of the week, depending on the days that the enrollers are there on site.
So I can't, if I send this memo out, I'm going to send them, letting them know that to hand it out, I guess, between Saturday, Sunday, or Friday, Saturday, Sunday, just to capture everybody, especially in our Orlando airport that we have most of our employees there. But they can't go live until, in other words, they won't be able to go in until
They won't be
Monday.
able, we don't have the self-service side open until Monday.
Okay, I'll make that a point.
I have a question for you guys. Are the employees going to be provided with benefit packets before they come to us, so they have an idea what they're going to let and what they not, or not?
Yeah, Maribel is sending out, and that email that she's emailing out, she has the information with everything that is being offered.
Okay, good.
I think Oscar was asking if there's going to be paper copies at the locations. Are they going to have the guides available to them, or it's just an electronic form?
It's an electronic form that's going to be on the forms library.
I see. I see. So they have access to it from their self-service portal?
Yeah, they just have to pick by employee class and location.
Ah, gotcha. So yeah, Oscar, they will not, in other words, the employees have not seen the medical plans until they either look at it online or they sit with an enroller.
Okay, so they don't have the packets that they usually send prior to meeting with us. And okay, I already look at the package. I know what I'm gonna get. I know the
Well,
plan.
yeah, they just don't have it. They're not going to have it physically. They're going to have it electronically.
Okay, as long as they have an idea what they are and stuff like that.
Yeah, and the key thing this year is that their benefits are better than what they were last year across the board. So everything all the benefits are much richer than what they had before. So I think it would make it easier for them to pick something as well.
Okay.
What I might do, Lauren, is perhaps send a package out to all the units, and as they are handing this out,
The reason I ask because it will be a little bit time consuming if they have no idea where they're going to get it versus if they already know, okay, I'm gonna have this plan, I'm gonna have this, so we can move it along. I don't know how much time are we gonna have with each employee, time frames between appointments to meet with employees. So that's the reason why I'm asking this.
maybe we can make like a 3-pager thing, just with the
What I did send you was there was a side-by-side per location, per class to have every single plan. Maybe that one is easier than having to go through the entire guidebook.
Right. And then they have the guidebook online. At least this way they can briefly see and that there's, and maybe the other flyer attached, saying that there's other, Allstate plans that they can ask for. That's also on a case-by-case individual person. But at least they'll be able to look at it.
The only thing about the side-by-sides that I sent you is, depending on who you're sending it to, I'm not sure how you feel. I mean, you'll probably have to filter your list of who you're sending everything to, because they do have the rates on there, and I'm not sure how you feel about them being able to see what the partners get.
Yeah, no, I would like to adjust that and take the dollar amounts off. Because the PDFs that I got, some of them are like out of line. They're some things are overlapping.
Are you talking about the guidebook or about the side-by-side?
Well, the guidebook, the side-by-side is in the guidebook, isn't it?
Yeah, it's the benefits guide that I was looking at.
Yeah, there's one also there, but I also send you a separate one.
Okay, I'll take a look at that.
This overlap, right? The dental and vision is overlapping?
Yeah, and there's a couple of other things that are not they need to either be spaced down.
After the call, and I'll resend it to you guys.
That will get fixed for you.
Yeah.
That's good. And
I mean, it's just probably technical.
Yeah, I'm sure it's just a little thing.
Though, we can take the rates off.
Yeah, I can take the rates off of the side-by-side too. The only thing about taking it off is that it kind of defeats the purpose of the employee kind of knowing what they can pay out, at least for the hourly, So I don't know if you want to leave it for, I mean, it's up to you, but just keep that in mind, that helps them also determine what exactly they want to purchase.
Right. Well, we can just put their rates. Like, remember that Excel spreadsheet you sent me, Lauren, and I entered what our contribution is?
Yeah.
You could just leave their part.
Yeah, that's what I sent you.
Okay, that'll be fine. I guess that one, the dental, the vision, and a flyer for Allstate to let them know what's available.
Now, the dental and the vision are not on that one, though. Do you want that as well on it?
You can, yeah.
Okay, so then I'll do a separate one for that one.
And our enrollers, the best thing to do at these locations is to have your own copy, like just of those important pages from the benefits guide. That's what I would do. Just, have your medical plans, that side-by-side comparison. and just based on what kind of a job class the person is, you just show them that page. So right there they can see and make the choice. Even if they come to you not knowing anything, that's kind of our job to be there and educate them on that. So it's not a big deal if they don't have it, but definitely have a. I really need a paper copy. I don't like the electronic when I'm already using one system. But it's up to you. But we are good to go.
Now, Christine, are we going to have a separate call in regards to implementation once that comes around?
In regards to what exactly?
I know that you're taking care of submitting stuff, but I've been seeing the emails, you're asking for like EDI and stuff like that. I want to just kind of cross over exactly how everything's going to be sent out and going forward for new hires and stuff like that.
Oh, okay. Yeah, we can do a separate call for that. I have all the information. My IT team is reviewing the information that came over from the carriers, the new carriers, to confirm exactly what type of reports they are. I look at them and I'll be honest with you, they all look Greek to me. So I can look at it and say, well, they're saying EDI in the email, but a lot of times it's actually not EDI, it's actually just a customized file. So they're confirming for me. Once those files are set up and in place, now mind you, an EDI file can take anywhere between 6 to 12 weeks, and depending on the carrier and their testing phases, it can take longer. So we will definitely need to discuss once we send them the open enrollment files, because they take those first, how to handle changes until an EDI is in production. Now, if it's just a customized file, those tend to go a little bit faster. But those are definitely conversations we're going to have with them now that, once my team reviews the full file, and their conversation back with you and Maribel.
Okay.
Okay?
All right, thank you.
You're welcome.
So
and I think,
that's it.
Is that everybody?
Yeah, I don't have anything else right now. I'm going to definitely resend you that. I'm going to go looking through all the benefit guides real quick and then resubmit them to you all.
Excellent.
Fantastic. Thank you.
I have a question for you.
Yeah. Go ahead, Oscar.
Are we going to have like dummy names that we can practice on the system before we go live, or that's not possible?
Yes, there are some test employees in there. So if you type in the search box when you're under employees, test, there's several different employees, and there's employees. Alina, if you're willing to kind of just show them that, I want to show them a quick little, helper so everybody can have the opportunity to test on everything. So once you're in employees, you type in test. You'll see a whole bunch pop up. Will you go ahead and click on one of the names really quickly for me?
It's going to be hourly in Orlando.
Okay, so let's say, for example, Oscar, you want to test this employee yourself. There's you have a team member who's going to be there with you as well, who's going to be testing and want to walk through the system. Once you go through and finish it, do you see right on the left-hand side, it says enrollment status? When you walk through, it's either going to say incomplete or complete if you sign at the end. All I want is either for you or whoever is your team member, if you guys click this reset, it's going to move that person back to not begun so the next person can actually walk through. So if you come to somebody and you see they're complete, a test person, and you haven't done it yourself, just click that reset, and then you can walk through.
Thank you very much. That will be very helpful. Appreciate it.
No, not a problem.
Awesome, you guys. Well, if you don't have anything else, this is it. We went a little bit over our time here, so thank you so much for your patience and your time.
Thank you, guys.
Thank
you. Thank you.
Have a good day, everybody.
Anything else?
Thank you. Actually, Olena.
Oh, I'm good. I'm good. Thank you.
Okay. Thank you.
Oscar? Yes?
I just have one more question. If the employee doesn't want to elect any core benefits, but they want to elect some of the voluntary benefits, are they be able to do it, or they have to have core benefits in order for them to do voluntary?
It's a la carte. Yeah, just they don't have to take medical to get voluntary.
Okay, all right. Because
Yeah.
some employees they have already benefits with through their spouses or something, and they only want to have a couple of days here. So I just want to make sure that they can be able to do that.
No, you're good. And if there would be any restriction, the system would set up for that. So, but no, you don't have. They don't have to.
Okay, so they can do whatever they want. Okay, great.
Awesome. Well, thank you guys. Have a good afternoon.
Thank you, Olina.
Thank you.
Have a good evening, everybody.
Bye bye.